All right, now to begin our discussion, first off, I need to introduce our studio guest this morning. We have Dr. G. Ampuma Chumesi. He's a sickle cell specialist, and he's also the medical director at Adwa Boatima Memorial Clinic. Good morning, Doc.
Good morning.
How are you?
I'm fine.
Great.
And you?
I'm fine, thank you very much.
Okay, good.
Doc, first off, let's talk about the traits of sickle cell patients, because a lot was described there in the video, and usually we tend to look at the physical signs rather than looking at within the blood where we can't as to whether or not somebody has sickle cell. So what are some of the things that would stand out to somebody, a layperson, for somebody who has sickle cells?
The introduction has actually said everything, but then what is important now is to show some of the pictures or to tell the people how to recognize the sickle cell.
Right.
It's very, very important, because if you haven't been able to recognize it, it is in the community, and people have to learn to recognize it so that when they need help, they can easily be given help.
Right. Okay.
Okay.
So what are some of the things that we should be looking out for?
You see, first thing that one has to look out, especially the nurses and the mothers, that a child may have the spleen enlarged.
Okay.
If you put your hand here, the spleen is enlarged.
So it'll be the lower left side of the abdomen.
Yeah, lower left side of the abdomen.
Okay.
And sometimes the liver too is enlarged.
Okay.
So that is the first thing.
Okay.
And then another first thing is what is called hand and foot syndrome. That is, the hand may be swollen. A child of about a year, may have the hands swollen. Oh.
That's correct. Let's move on.
Okay.
Yeah,
so
continue.
you see, that is the hands and the feet
will be
swollen, and that is a sign that like this.
Okay.
That is a sign that the child may have the sickle cell disease. You see here, the hand and the foot are swollen. That is a clear sign of the sickle cell disease.
Okay.
So
now, at what age should the parents?
That is from about 2 years.
From 2 years. Okay.
That is from 2 years. Then the blood, the child's blood, what is called fetal hemoglobin, has changed to the adult one.
Okay.
And that is when the disease starts to show.
Okay.
That's right.
All right.
And some of the signs that one can also see in the society or in the community is somebody who has the head is so big, or it is oblong and then it's changed.
Okay.
You see, that is also a sign that a person can see in the community. And then other signs are this, that the teeth is protruding.
Okay.
It is not everyone, but some of them, when the tooth is protruding, then you check or you find out whether sometimes the eyes are yellow and cleared and so forth.
Okay.
These are some of the signs that one can use to know that somebody has the sickle cell disease.
Okay. So we've got enlargement of the spleen,
enlargement of the spleen, and then the liver,
and then the head being large or oblong shaped,
and then the eyes being yellow, and then it clears and so forth. And what is another thing is very important is that the person is small for age.
Okay.
That you look at somebody who is supposed to be, say, 10 years, and look like somebody who is 3 or 4.
Right. Okay. So they're very small in size.
That's right. These are some of the signs of the sickle cell disease. And then when you have a child who has a stroke, it's one of the signs of the sickle cell disease. That is one of the most important things that you can know that this person has sickle cell disease. Okay. And then we have this leg ulcers. That leg ulcers, because the blood is low, the blood level is low. When anything scratches somebody who has the sickle cell disease, it doesn't heal.
It doesn't heal.
And then it starts to become bigger and bigger. Okay. And so that's a sign of one of the signs of the sickle cell disease that anybody can use to know in the community that somebody has sickle cell disease.
Okay.
This is another sign of that the stomach is big, and you see that I've marked down there that the liver is enlarged, the spleen is enlarged. You see, these are some of the signs that one can use to know that somebody has sickle cell disease.
Okay. Now, going forward, I mean, people want to know because first off, they will live past 25 or not?
Yeah. You see, I have another picture here who tells you that sickle cell people can live as long as anybody else.
Okay.
Provided that, just like you take good care of yourself.
Okay.
We have a certain lady, a woman who is SS and was 90 years old.
I have a cousin who is in his 30s or 40s.
So that one is not a factor.
Yeah.
You see, it all depends upon how you take care of yourself.
Let me ask you this then, because one of the reasons why we would ask these questions, because as we're growing up, let's say we meet somebody who does have sickle cells.
Yeah.
If I marry this person, does that mean automatically we would have children with sickle cells?
No. You see, this is the old lady I'm talking about, down there.
Okay.
Yeah.
We'll show her later.
You see, if you have somebody, if you marry somebody who has sickle cell, or let's say two people who have, let's say, the carrier state, somebody carries the sickle cell gene and another person carries the sickle cell gene. When they get married, let's say one is AS, one is AS, there's a chance, a possibility of having children who have AA, that is, they have the normal genes.
Okay.
And then you can have people who have mixed one, AS. Okay. And then you can have children who are SS.
All right, so there is a possibility that you have children with sickle cell?
25% possibility of getting it. But it does not mean that one will get it.
Okay.
It can also happen that none.
Okay, understood.
Or it can also happen that all of them.
Okay, so
because every pregnancy is an event or an act by itself. It is not influenced by another pregnancy before.
So it's actually feeding
after.
into my next question then. So which people who have sickle cells should not marry and have kids then?
You see, that is something that people argue or say it shouldn't be, it should be, and so forth. This is a personal question. You know, I would say that people who are SS, pure sickle cell 2, SS, it will be unadvisable.
Right.
To marry. But then people who are, let's say, AS, carrier states, you see, then it can happen that all the children will be AA.
Right.
So it is very difficult to say that don't get married.
They have to take it upon themselves and advise themselves.
You see, and marriage is also something that God has, it's God's institution. And sometimes it is this one and that one which are put together.
Right.
You know, and you cannot put it asunder.
Okay.
So it's very difficult when it comes to that.
All right. Now, in regards to preventing sickle cell, is that possible? Can you prevent sickle cell?
You see, sickle cell is inherited from the father and from the mother.
Okay.
This is a situation whereby you cannot prevent it after it has happened.
Okay.
It happens at pregnancy. So the only way you can prevent it is to stop people from getting married. But this is something that we cannot do.
It's been said that sickle cell does have some advantages. One, they say, is the fact that you do not get other diseases, such as malaria.
Not other diseases. Sickle cell, if you have sickle cell trait, then it's hardly that you can die of cerebral malaria.
Okay.
Because if you have the trait, let's say AS or AC, the malaria parasite, you get malaria all right. But the malaria parasite cannot develop inside you enough to get a serious cerebral malaria. But the sickle cell itself, the only advantage is that if somebody has sickle cell disease and the blood level is say 4, he can survive. But somebody who hasn't got the sickle cell disease, if the blood level falls to say 7, the person will die.
Right, I get you.
You see, so there's a little advantage there.
All right. Now, one of the main things that you said when we started this conversation was the fact you wanted people to be able to recognize sickle cell patients, and obviously so that we can help them when they have crisis. So what happens when a sickle cell patient has a crisis, and what can we do as concerned citizens?
You see, sickle cell crisis is probably out of the blues. You start to have pains in the joints here and there and so forth. That is somebody who is a known sickle cell person, has, let's say, caught in the rain and start to have pains here, is eating me in the bones and this and that. You see, all that you need to do, the first aid you have to do is to keep the person warm.
Okay.
Because when the person gets sickle cell crisis, it means that the blood is not moving.
Okay.
Because
So you
it's
need
cold,
to warm them up so
you
they
warm
flow
the
easily.
person up. Give the person enough fluid to drink.
Okay.
And if possible, massage the place if it's not swollen or something.
Okay.
And then give the person a painkiller, paracetamol, not any serious one.
Okay.
And then send the person to the hospital. Sometimes when you do all these things,
You might not even have to.
you might not need to go to the hospital.
Okay.
Yeah.
All right, but that's the main thing that we should do.
Yeah, the main thing, the first thing you have to do, keep the person warm, plenty of fluids, massage the place if it's not swollen, and then some painkiller.
Okay, so what would be your advice to people who have sickle cell in order for them to maintain their health and try and be as healthy as possible?
Yeah. You see, yesterday I was talking to one of them. He says he has been having crisis about 11 times this year.
Wow.
I said, what? And he's over 20. Then I told him that, look, if somebody at your age has crisis so often, then it is your lifestyle.
Okay.
You see, so for somebody with sickle cell disease, is the lifestyle, which is very, very important.
So what should they
That
avoid?
the person should make sure that he eats enough, nutritious food.
Vegetables,
Drink plenty
proteins.
water, exactly,
Right.
and drink plenty water, because the water will go into the blood system and let the blood move.
Okay.
So even if the cells are sickled, it will just move.
All right. Now, I mean, things like alcohol. Alcohol thins the
Yes,
blood.
alcohol usually it makes the person dehydrated.
Right.
It takes off the fluid.
Okay.
So if somebody having sickle cell disease and drinking, it doesn't go
It doesn't
together.
go too well.
That's right.
Okay, so basically, they should keep themselves healthy, make sure that they're
Exactly.
eating the right protein,
Exactly.
vegetables, and exercise.
Exercise, yes, but not over.
Okay.
I tell them that even in school they have to do the PE, but they have to let the teachers know
That they are.
that they have the sickle cell disease.
Okay.
So when they are tired, then they have to stop.
So basically, nobody with sickle cell could be a professional athlete.
No, that one I will say no.
Okay.
Because the blood level is low, the blood is not moving faster to the brain and everywhere. So if you exert yourself too much, you may overcome that, and then you can sort of collapse.
What's the most incorrect fact you've heard about sickle cell so far that people may have been putting?
Yeah,
out there?
people have been saying that it is from the old lady, it is from the witchcraft and this and that. It is not. It is inherited blood disease from the father and the mother who carry the bad gene that they pass on to their children.
Right. So anybody with sickle cell shouldn't be blaming the devil.
No.
or witch.
No.
should blame their
There
parents.
have been cases whereby somebody will fight his father or mother. You brought me the disease. Yes, but it is not the witchcraft.
Right.
It's not the old lady. You can't go and beat the old lady because you have sickle cell. It is unfair.
All right. I want to say a big thank you for coming in.
Welcome,
this
sir.
morning, Doctor. This has been Dr. G. Ampumachumisi. He's a sickle cell specialist and also the medical director at Adwa Boatma Memorial Clinic. And this morning we've been discussing sickle cell.